Good morning, good afternoon. Welcome to the Center for Global Development. I'd like to welcome those of you who are here and many more of you who are watching us and participating online. Let me just start off by saying that this is the first time we are able to get together in 18 months to have this kind of event with, here you see, 4 of us sitting on the stage. And that's not been possible. I do recognize actually what a privilege that is. That we are in a privileged position that we are able to do that. So many people in the world and so many of you who are watching this online are not yet in a position to do that because we've just not been able to make progress globally in terms of vaccinating enough people in enough countries to achieve that. And for that reason, I think there really couldn't be a better starting point for this event, this first event, than to focus on the recommendations of this report, which has been produced. This is a report that has just come out, produced by a high-level independent panel that was commissioned by the Italian presidency of the G20. And the panel was chaired by 3 co-chairs. Mr. Tharman Shanmugaratnam, who is Senior Minister in the Government of Singapore, Dr. Ngozi Okonjo-Iweala, who is the Director General of the World Trade Organization and a distinguished non-resident fellow here of the Center for Global Development, and Professor Lawrence Summers, the former Treasury Secretary, and we're very privileged that Larry is here today, and Larry also, of course, has a deep connection with the CGD as the chair of our own board. So they were the 3 co-chairs. There was an eminent group of members for this panel. I'm not going to list them all. They're all on the listed in the report itself. There were 2 distinguished scientists who were advising the panel, Sir Jeremy Farrar of the Wellcome Trust, and Dr. Victor Zhao, president of the National Academy of Medicine. And Victor, I'm so glad also that you were able to come and join us for this event. And the work of the panel was supported by a technical team, and the technical team comprised of colleagues from Bruegel, the think tank based in Brussels, and us here at Center for Global Development, and Amanda Glassman, who's the final panelist today, was the leader of that work for us at CGD. And I should acknowledge, I'm trying to see if she is sitting here. Yes, she is. There is Asisha, and there was a very able secretariat that actually ensured that all of these different component parties came together to produce this report. And I do encourage you to be able to look at it. So this report, as I said, has just been launched, and we thought today would be a good day to share with you some of the takeaways from this exercise and also the specific recommendations on how we can both address the problem now, and there's really a problem now that we are falling behind in the global race to try and conquer or beat this virus as it spreads. But also, how do we prepare for the future? And as my colleagues will just explain to you, that future is likely to see more pandemics rather than this being a one-off event that doesn't get repeated. So the plan for the remainder of this hour is that I'm actually going to ask Larry, and then Victor, and then Amanda to provide some initial reflections and their interventions. And then we're going to open it up to questions from both people that are present here today and also from those of you who are online. And those questions will come through to me, and I will pass on to our colleagues. So with that, without further ado, let me turn to Larry Summers and ask you, Larry, to please lead off and share your reflections from this work.
Thank you, Masood, and thank you everybody who's listening in, and thank you to all the various constituents of this effort. Those like Tarman Ngozi and myself, who are chairs of efforts like this, are neither the principal workers on efforts like this, nor the principal sources of intellectual inspiration on efforts like this. And so anything that I say that is valuable is somebody else's thought and somebody else's effort. Let me make 4 points that together, I think, capture what is a very long, complicated, and comprehensive report. First, the ongoing pandemic and the next pandemic and the pandemic after that constitute a global human security challenge as great as any other. The incidence of coronavirus, according to reinsurance industry data, has been increasing at a rate of about 8% a year. The go-forward pandemic risk, in a statistical sense, from the flu is substantially larger than it is from coronaviruses. The many cases that we have seen, Zika, N1, H1, SARS, MERS, Ebola, it is probably as right to say that we were very fortunate and lucky with respect to them as to say that the world has been unlucky with respect to COVID. The cost of COVID, simply in terms of the necessary fiscal response, is measured in the tens of trillions of dollars. The proposals under discussion are measured in terms of the tens of billions of dollars. That is a 1,000-to-1 ratio. We believe that the nature of the problem, in its occurring intermittently through sudden events versus continuously and over the long term, is different between global health and climate change. But in terms of their potential over the next quarter century, they are comparable in their impact. And so the first overarching message of the panel is a sense of the enormous urgency of action. The second message of the panel is that the world's response and the world's preparation prior to COVID, despite the many warnings that are listed in our report in terms of the 8 or 9 epidemic or pandemic events that have already taken place in the 20th century, was fragmented, incoherent, far short of potential efficacy, and much less effective than could have been possible. And there is therefore a need for strengthened mechanisms of global governance, both with respect to the response to pandemics and with respect to efforts to prepare for future pandemics. We draw an analogy, it is a loose analogy between the problem of financial crisis and this set of issues, and note that the FSB, the Financial Stability Board, has been a rather effective mechanism for responding to these crises in a substantial way. And we call for the establishment of a Global Health Threat Security Board that would be in a position to coordinate, pressure, cajole, and organize the various pieces of this vitally important puzzle. Third, we emphasize that there will be a need for substantial resources above what is currently being allocated if these threats are going to be met. Appropriately and of necessity, a substantial part of those resources will be domestic. And we make clear that strengthening health systems will, it varies from country to country and situation to situation, require increases in expenditures on the order of 1% of GDP to have the kind of health system that, in addition to providing more ongoing strength, will be in a position to respond when epidemic and pandemic threats take place. We also estimate that an additional $75 billion over 5 years in global funding is an extremely conservative estimate of the necessary new infusions of resources if these challenges are to be met. We call for the establishment of a new $10 billion annual contribution fund to make the necessary investments in global surveillance, in development of necessary global capacities, in preparation of and strengthening of relevant systems, in relevant kinds of research, to make sure that the world is better positioned to respond to future pandemics than it was this time. We note the close synergy between the construction of the facilities necessary to see the world through the current Delta variant emergency and the preparation of capacity to be in a position to respond with PPE, with testing, and with vaccinations to future pandemics. Fourth, reflecting our role as a finance task force, being comprised of 3 former finance ministers, we call for a reimagination of the international financial institutions, most conspicuously and importantly, the World Bank, around the challenge of global public goods, those goods for which all are a part or not a part, but for which there is no excludability, and those goods like scientific knowledge that have the property that if one person, one beneficiary, does not detract from the ability of others to benefit. We note that precisely it is the nature of public goods that there is limited incentives to create them rather than to free ride. and that because they are excludable, they are difficult to sell, and therefore difficult to provide a pecuniary basis for repaying loans when they are to be financed. And so we believe that very substantial imagination is necessary in the reimagination of these institutions. We applaud the $650 billion SDR allocation. We applaud some of what has come out recently of the institutions, but we believe that much more is possible and much more is necessary. But I would conclude on a note of extreme urgency with respect to both the current and prospective pandemic challenges.
Thank you very much, Larry. Thank you for giving us that broad framing of the work. Victor, could I turn to you next, please? And so you've been with the panel and you've been looking and observing and participating in those discussions, and your broad experience and background, what would be your takeaways and advice in terms of moving forward?
Thank you, Masood, and great honor to be with this panel and having the chance to serve as advisor to the G20 high-level panel. You know, as a global health person, I'll say this report is really welcome. It's extremely encouraging to us because, as you know, for a long time, we've been worried about this issue. And it's no news to you that the community's been vocal about the lack of preparedness. After Ebola crisis, many of us, including the national academies, wrote reports to call for better preparedness, more financing, a better governance structure. Of course, we all know nothing much happened. And I serve on the Global Preparedness Monitoring Board, GPMB, and in 2019, we put out a report to say we better be worried about a respiratory pathogen that's lethal. That would be phenomenally bad. And of course, you know, nothing happened until less than a year afterwards, we have COVID. I think we all recognize that this really should never happen again. And you know, for someone like Larry, who asks me this question continuously, can you predict when the next one's going to happen? I'll say that in talking to our community, we know it's going to happen. Only issue is when. I want to read you a quote from the report. The threat of future pandemic is already with us. The world faces clear and present danger of more frequent and more lethal infectious disease outbreaks. This current one is not a black swan event, but merely a dress rehearsal for something that couldn't come anytime in the next decade or even next year. And I agree with that. If you look at, and as Larry said, the frequency of outbreaks that's happened the last decade, you can see a really tremendous trajectory. So we really need to be prepared. So while number one, we really have to control the current pandemic, but I don't think we can wait until this pandemic is over to scale up prevention, preparedness, response for the next crisis. So my question is, as a global health person, what are the issues and what do we need? So I would say I'll list four. First of all, we do know that our response preparedness to COVID has been a collective failure globally. It's that every sector, if you think about this globally. But I think the four areas I would say would be one, lack of a good surveillance capacity to be able to detect a pathogen with pandemic potential. Today, our tools and strategies are really mainly designed to monitor known pandemics and ongoing seasonal influenza. What we really need is to detect a pathogen with the potential pandemic, like coronavirus, before it became widely transmitted. We need to work along, of course, with sectors, domains of human, animal, and environment, the One Health approach, in order to be able to work together and detect and monitor existing and new zoonotic pathogen strains, and particularly those with pandemic potential. Second, as Larry said, the problem with national health systems and public health has been struggling, as you can see throughout this pandemic, as we have in other situations as well. Ineffective public health and the health systems, delivery systems are overwhelmed. So there's a real need to have a strengthening of national health systems and a critical foundation for public health, primary care, in order for us to prepare for a pandemic. Third is R&D. Before the pandemic, there's really no coordinated R&D or end-to-end, if you will, from basic research all the way to manufacturing, supply, you name it. And so this really are fundamentally some of the major problems. And of course, lack of sustainable financing. Now, if a few good things happen along the way, bright spots like vaccine, I do think that we should be very proud of the fact that science have really enabled us to get a vaccine in unprecedented speed. And Act A, the access to COVID tools accelerator that brought together in an ad hoc basis the major players to collaborate to have equitable access to vaccines, therapeutics, and diagnostics, and development production. I've been privileged to be involved with that organization as well. But talking about financing, we're still struggling, despite the fact we're out there saying we need 2 billion or 3 billion doses, and we need PPE and diagnostic. We still have $16.8 billion of gap at this very point for this year. So you can imagine that we're not getting the kind of financial response and the support for what's really needed. I think one of the issues that I'm sure Amanda will talk about is the donor assistance model doesn't quite work. It's not sustainable. We need a much more reliable multilateral funding mechanism. And of course, as Larry said, the international financial institution need to be empowered to find ways to look at global public good as one of their major mandates. And of course, incentivize the low income and low middle income countries to really invest more domestically in their system by finding ways of this IFIs, et cetera, to give them incentives. So what I find really exciting about this is that this is a health economic expert report. And it's coming out from G20 and asking economists and finance experts to say, what do we need to do to provide to solve this problem? To me, that's really important because to date, the voice had mainly from us, public health, to say we need money, we need support. And for now, the finance people working along with us to say that's what's needed, I think is really impactful. For a long time, people see health as a drain of the budget, if you will, right? More and more demand, the cost is going up, but in fact, as Larry said, the investment that we're asking here by far exceeds the damage to the economy. So this is a much bigger issue and shouldn't be seen as a health issue. I would just simply end by saying the following. How are we going to spend the money? Well, first of all, we do need, as Larry said, a much better governance structure. The global health governance, shall we say, the host community is very fragmented. And we do need some mechanism to bring together to be able to move things forward in an accountable way. But I would say investment in surveillance, massive scale-up of global surveillance and alert systems, sharing data across countries, and transparent reporting data, a lot of cutting-edge technology that's needed, should all be invested in order to prevent the future problem. On the national system, you already heard, there's got to be a whole of government, whole of society approach. And certainly in the supply area and research, I'd like to spend 1 minute talking about this. Because along the way, we discovered that despite great research, The difficulty is actually getting enough supplies, whether it's PPE, oxygen, diagnostic testing, or vaccines. And while there's really, Act A came together in a really effective way, what we learned, of course, is that we need to do things differently. And Act A, which is ad hoc, we certainly believe there should be a permanent structure like Act A. Not exactly that, but learn from it and create something that can create a network of people coming together, tightly coordinated, to be ready for now and for the future. Research. I think the whole idea of prototype pathogen, there are probably about 25 viral families that are likely to be the pandemic potential pathogens. Just now doing research to say, can we get vaccine against these families would be important. But then you need to have investment and risk investment. And then the other issue, of course, we learned is vaccine nationalism and the problem with manufacturing. That's becoming an enormous problem, as you know, where countries are buying up the vaccines. Now with COVAX, we have secured good doses, not enough. But guess what? We're not getting the supply because manufacturing is occurring in different sites, and they're not reaching the countries that don't have manufacturing capacity. So to me, that's where we need. Creating a much more diversified, distributed regional sites for manufacturing, investing in more research for prototype pathogens, being able to invest in surveillance, and of course, investing national strengthening, and ultimately a good governance structure. So I'm going to stop here by saying we are very encouraged by the fact there's so much interest now. And of course, it's up to the people who hold the dollars to say, yes, we're going to invest and let people like ourselves do the job in helping us prevent and prepare and respond for the future. Thank you.
Thank you very much, Victor. Let me now finally turn to Amanda. Amanda, you're going to go into also some of the specific recommendations coming out of this panel. I think you're going to show some slides, so let's just make sure that those slides are visible to everyone on watching this. Here we go.
So I'll just go through the recommendations of the, let's see if this is on. Okay, I'll just say, next slide, please. So this G20 high-level panel, it's an independent panel, was mandated to identify the gaps in the financing system for the global commons of pandemic prevention, importantly, surveillance, preparedness, and response, and to propose solutions that drew on the full set of potential financial resources available. Next slide. The challenge, you've already heard about it, COVID-19, unfortunately, though catastrophic, is certainly not a one-off event. We have to plan now for the response to COVID and for endemic COVID-19 going forward, as well as the risk of potentially more frequent and severe pandemics. We all know that vaccinating a majority of the population in all countries is the most urgent priority of the international community today. But we also understand that whatever we suggest right now as a panel needs to build, it has to be useful now, and it has to build for the future. It's a race against time, and it is absolutely an essential task of national and global governance. Next slide. So as Larry already mentioned, the cost for the scale of investments required, while marginal in terms of the potential costs of, well, the costs of the current pandemic and potential future pandemics, is it's about $170 billion over the next 5 years. There are some startup costs associated with that because we have been underinvesting for years. Even in the wealthiest countries of the world, we're less than 2 to 3% of our national government spending goes to preparedness and public health. And of that, we estimate, the panel estimates that $75 billion of international financing is needed over the next 5 years, or about $15 billion per year. Next slide. To do what? Victor has already mentioned this. It's the gaps that have been identified are clear. global surveillance and research and development on medical countermeasures. Most countries have very low coverage of genomic surveillance. Many countries are not able to record deaths and cause of death. We're not able to track cause of death, so we can't understand what pathogens are circulating. This is an urgent priority. If we don't know what's going on, we can't act to respond quickly. The second piece is strengthening the national systems. There are broader pieces of that around supporting human resources, but the part that is a global public good, because this panel was very selective in the amount of money that it put into this fund, is really for things like public health institutes, surveillance systems, workforce that's able to respond quickly in the case of emergency. The third area is supply capacity for medical countermeasures. There's a goal out there that CEPI has announced about reducing the time to 100 days between the detection of a pathogen and licensure of that technology. But it's not just that piece, it's also the manufacture. And I think the panel came to a consensus that it's not simply a matter of each country acting on its own, that the solution to the vaccine nationalism that we've seen during COVID-19 is to reduce scarcity, get rid of to produce enough to keep ever-warm manufacturing and to be able to roll out the manufacturing capacity quickly. And finally, there was the global governance issue. That certainly couldn't say that the international community has acted as one. We saw last month that the IMF, the World Bank, the World Trade Organization, the World Health Organization came together to form a war room, but that was 1 year after the pandemic has started. We need to be acting quickly. We need to know who does what and respond quickly. Next slide. So what are the recommendations specifically? I'm not going to go through them all. I'll just focus on one next. The first was around building on the inspiration of the Financial Stability Board, which is another global public good to assure financial stability. The panel proposed a global health threats board under a G20 plus platform. Next. So the goal of that board was to track global risks and outcomes and to ensure that every country plays its part to enhance global health security. There are existing entities that are tasked with this, but they are not resourced to be able to deliver on that promise. Victor is part of the Global Preparedness Monitoring Board, but there are 2 people in a secretariat in the WHO that support their work. Their voice is out there, but we just need a much more systematic capacity. One idea that has been circulating is something like the International Panel on Climate Change, the Intergovernmental Panel on Climate Change, that is able to, in real time, assess risks and vulnerabilities, triangulate data, and issue independent assessments. A second task for this group was to ensure tight coordination amongst the key international bodies that work in this space. And then finally, to provide systemic financial oversight and to ensure enhanced and predictable global financing for pandemics before they happen and while they are happening. Someone to really be accountable for what happens. Right now, we don't have necessarily someone we can say, hey, why isn't this happening? Why aren't vaccines, why don't we know exactly the delivery dates for every country for the vaccines that need to get out there? This is what this board could potentially do. This is complementary to the International Panel on Pandemic Preparedness and Responses proposal for a Global Health Threats Council. That panel suggested a high-level National Security Council level entity. This is more of an operational entity that could work under the auspices of that other board. So we see them as very complementary. Next slide. There are a series of financing proposals. I'll focus on 3 of them. Next. The Global Health Threats Fund, the strengthening of financing for the World Health Organization and for One Health actions, and the financing of global public goods as part of the Multilateral Development Bank mandates. Next. So in terms of the Global Health Threats Fund, why do we think that this is important? Well, we've already talked about the scale of resources needed, about $10 billion a year. We've also talked about the sources of financing are required. We don't want this to be ODA dependent. We would like it to be a multilateral financing mechanism. So the panel has some specific recommendations on how to get this done. As Larry said, together with climate change, this issue of global health threats, pandemic potential pathogens is at that same level, and we need to finance it this way. If we look to the World Bank, there's a global environment facility that we looked at very carefully. It's a fund that is dedicated to climate change, mitigation, resilience. This would be sort of a counterpart for the response to pandemics. And it would seek to finance those 4 items that we've identified in gaps. I should say, one important reason that we need financing, particularly for low and middle income countries, although this is an imperative for the entire world, is that those little low middle income countries spend $30 to $50 per capita in public spending. They face enormous opportunity costs in the allocation of their resources, and therefore we need to complement their financing from the international source, because the benefits of that financing really accrue to their neighbors and to the entire world, more than even to their own population. Next slide. Together with the International Panel on Pandemic Preparedness and Response, this panel also agreed that it was necessary to strengthen the financing for the World Health Organization and One Health. You know, the assessed contributions, which are the money that governments give to the World Health Organization, only amounts to $1 billion a year. And we expect this organization to lead and coordinate response to pandemics. It's laughable. That's a small fraction of what, as Larry frequently says, the cost of a hospital system in a major city in the United States. It's nothing. So that reform needs to happen. But the other piece of this also is to make sure that the other UN entities that work on One Health are also adequately financed. So we called on an increase in assessed contributions, and we would expect that they would also receive financing from the new fund that we've articulated. Next slide. And then finally, there's the issue of enshrining global public goods like pandemic preparedness and climate change, climate action as part of the core mandates of multilateral development banks. This is not the first time that people associated with the Center for Global Development have made the case for this to happen. Larry actually led a high-level panel approximately 5 years ago that suggested the same. And it's about using the World Bank and the other MDB's resources more creatively, more innovatively, to really work on those regional issues, those areas with huge spillovers, create concessionality in their lending instruments to promote government investment in these areas. And also, we need to think then about the capital replenishments of those multilateral development banks. We have the IDA replenishment coming up. That's the grant financing window of IDA. We have the potential to look at their capital and see how we can stretch and leverage those contributions so that it doesn't come at the expense of other important goals. Next. So we'll end there and turn it back to Masood for questions. Thank you.
All right. Well, thank you very much, Amanda, for walking us through all the recommendations. And there's a lot of material there. I do encourage you to take a look at the report, and you'll see the link right there in terms of being able to access it. Let's take a few questions. I've got some online, but before I go to them, I want to make sure if there's anybody in the room that has a question they would like to pose to the panelists. And there you are. And it'd be great if you could just identify yourself as well, please. There's a mic on its way to you. There you go.
Advas Saldinger from DevEx. And Amanda, you talked about this briefly, but I was hoping you might be able to go into more details about how the Global Health Security Board would complement and not potentially recreate the same functions of the Global Health Threats Council, because I think that's a potential concern that there would be redundancy or it would take away power from some of the existing bodies or existing functions at the WHO that could either further weaken those or create some difficulty in the global system.
Got it. Thank you. Any other? Maybe we'll take a couple and then come back to our panelists. Let me add a couple of other questions that have come in and then ask our panelists to respond. I think one question that's come in is really the trade-off between financing the increased needs in global health. We talked about 1% of GDP, and the fact that many countries have had a big hit to their economic recovery as a result of this pandemic, and they'll need financing for economic recovery. How do you compete, or how do you manage or prioritize across that? And also, how do you prioritize between this and the other big need, which is climate change? So in a way, people, the question that is being posed is, climate change is a big priority. How do we deal with that? That's one question. Another question maybe, and I think, Larry, you were in Venice last week with the G20 finance ministers where they considered this report. I guess the question is really about appetite for moving forward. The question is, right now we're in the middle of this pandemic and we're still having difficulty. Victor, you mentioned $16.8 billion gap right now, and we can't seem to be able to fund that. And although the economic case for investing the low tens of billions of dollars a year to get savings in the low tens of trillions of dollars a year is so compelling, do you feel that there is some realization of the political imperative of moving forward, and how hopeful should we be that these recommendations will get implemented? And then the final question is really one about we seem to rely a lot on existing institutions doing better. So we're asking for the IFIs to take on a different mandate and different role. We're asking for the global health organizations, which, Victor, you said have been somewhat fragmented. I think that sort of come through in their response to this pandemic, coming together in a more effective way through this board that's going to be created, this oversight. How confident should one be about the ability of existing organizations to adapt and change, or do we need, given the nature of this threat, some dedicated new mechanism, new institution to deal with it? So that's a question also that's being posed. So let me pose those questions to you, and perhaps Larry, if I could ask you to lead off again and pick up on any of those questions, and Victor, and then close out with the map. Sure.
I think that the policy imperative has yet to be fully transformed into a political imperative. And I think it's the function of reports like ours both to draw together facts and perform analysis and contribute to the conversion of policy imperatives into political imperatives. I am guardedly hopeful, based on my conversations in Venice, my conversations over the last couple days with the range of officials in the United States government, that the awareness is growing and the plausibility is increasing. I think it is a mistake when we treat as immoral the natural human urge to take care of one's own before taking care of others. That is the way of families and the way of nations. And it has been the way of the world's affluent countries. But I believe as we shift from a moment in the United States when the challenge was getting vaccines to people who desperately wanted them, to getting people who desperately need vaccines to want them. As that shift takes place, I am hopeful that the political climate with respect to global efforts will very much increase. Just to make two other remarks. I think that it is not a viable long-term strategy for the world to pursue an approach of one challenge, one institution. That the right strategy has to be to foster institutions who will evolve over time as challenges necessary take place. And that's why our approach puts considerable emphasis on institutional reform, particularly of institutions like the international financial institutions that have demonstrated their capacity over time for substantial reform. The IMF was originally the guardian and custodian of a fixed exchange rate system between the major currencies. The World Bank had as its central role reconstruction of Western Europe. The idea of lending for education or health would have been inconceivable partway through the history of the World Bank. I think that with respect to the issues of redundancy and overlap, that there is a careful balance to be struck. I was amused but a bit educated some years ago when, after a discussion of bank fund collaboration, some set of demands that there be clearly delineated rules so that there be no overlap, someone at one of the institutions who was getting impatient with the discussion said, "Tell me, sir, is it your preference to fly on planes without co-pilots? So great is your desire to avoid redundancy." And I thought it made a fair point. So I think that optimal football defenses involve some overlap of responsibility between the safeties and the linebackers, and some similar kind of thinking is appropriate here. And I guess the last thing I would say is it seems to me, and maybe it's presumptuous for me to say this, but it seems to me that finance officials would make a grave mistake if they were to be anything other than terrified at the prospect of having responsibility for scalpels or anything involving RNA. And it seems to me that prudent health officials should very much welcome involvement of those who control resources in their efforts as a way of mobilizing more resources.
Thank you very much, Larry. Victor.
Well, I take two issues that's been raised. One is on the economic imperative, and second is, can global health people come together? Larry probably doesn't remember, but back about more than 4 years ago, at a spring meeting World Bank, he actually hosted dinner, and he brought together the Minister of Finance, which he invited me to attend. And I was making the case that they need to invest, right? So you can imagine how encouraged we are now that the entire G20, with leadership such as this, are saying, let's take this seriously. So the economic question, to me, it's a false dichotomy between, do we fix this problem now, or do we fix the problem in the future? Just think about the early debate we had in this country about health versus economics. And of course, we learned that we don't take care of health, the economic impact is much worse. So suddenly we now realize this is the same thing. So to me, it's not a choice between funding now and funding for the future. We've got to do both. But as Larry said, it's about 1,000%, or 1,000th, if you will, of really the cost of the damage to the dollars that we're asking people to give. So it's a trivial dollars. If you think about relief packages of trillions of dollars, this is only $15 billion for many countries per year. To me, it's really it's a very small sum. And I think it's really a forced dichotomy between a choice. We got to do it, stop now, got to prepare for the future. I think money talks. We talk about the issue of governance. I know my colleagues, if I look at X Accelerator, I still remember in April, the phone calls we had to say, what are we going to do together? And where we are today. I know people rise to the occasion, particularly when there's resources that now enable us to do things, not compete with each other for those dollars. And the multilateral nature is to be critical. So you're not kind of having cup in hand to say, how do I get more money from this guy, that guy? So I think this report is spot on in the way, at least from my point of view, how we need to move forward.
Thank you very much, Victor. Amanda, so including the point about, are we basically proposing this Global Health Threats Board? How does it relate to the Council?
So both of these obviously are ideas, proposals that are circulating. I understand the IPPPR proposal of the Global Threats Council to be a political level, heads of state effort to assure oversight and accountability on an ongoing basis. So I'd say that's the political instance. What we're talking about, it has three specific functions. It could build on some existing entities that already exist. It could represent an evolution of those, but it's three pieces, right? It's the sort of independent assessment of risks and vulnerabilities, and there it has the exact translation with what the Financial Stability Board does, and also inspired by the idea of this intergovernmental panel on climate change. It's what is happening with the science, what are independent takes on this issue. It's a complement, an essential complement to the official estimates that would come out of the World Health Organization or the animal health organizations that work in this space. And then the second part is, if we can do this dedicated funding, the idea is that it would provide some oversight and ability to allocate and also reallocate amongst the existing entities that provide financing into governments, as well as into the international institutions or specialized technical entities. And I think that ability to allocate and reallocate, if we had had such a fund and a mechanism during COVID-19, for example, one thing Seppi said is, I could have put up early manufacturing money for Moderna that would have enabled us to purchase larger volumes of Moderna for low middle income countries through COVAX. They didn't have that money in place. They did some of that kind of investment, but they could have used more, and we could have just said, I'll move it over here. We need dedicated money for this use, both when crisis strikes and also for preparedness.
Thank you very much, Amanda. Well, I want to thank everybody.
Masood,
Sorry,
is
Victor,
it not
please.
fair to say that this board that the panel's proposing is really made of finance and health track administrators? That to me is at this level of relooking at how the money is being spent. The board at IPPR Council is at the heads of state level in UN. I think they're complementary. They're not competitive.
Exactly.
Right? You need a high level global, and you need people who are having decisions about money, tracking, accountability. So to me, they're not mutually exclusive.
No, thank you. Absolutely. So I want to just end by saying, I want to come back to the point that Larry made at the beginning, which is to reinforce the sense of urgency. And I would just add to it urgency and ambition. I think there is urgency, obvious urgency in dealing with the current pandemic. But one of the things that I must say I took away from supporting the work of my colleagues on this panel is that there really isn't a whole lot of time left to start preparing for avoiding the same mess we got ourselves into this time round. So there is also urgency in terms of going forward and preparing for future pandemics. And the second thing that I would add to it is ambition. We've come up with our set of recommendations. The IPPPR has come up with a set of recommendations. There's another panel in the works that Mario Monti is chairing. They'll come up with a set of recommendations. there's probably 90% overlap in terms of what each of these distinguished group of people is going to recommend. And there's a compelling case for why you need to make some changes that are non-incremental to try and deal with the future and make sure we don't have the same problem. There's now going to be a G20 ministers and governors have created a task force from their staff that will help to prepare the recommendations. They will meet in October again, and that will be the moment where they will take some decisions. And I guess my hope is that when they take those decisions, there are short-term constraints that everybody's very squarely facing and conscious of, but there are long-term imperatives that will be the ones that in the longer term we will all be judged by, and I hope that they all strike the right balance on ambition there and follow through with this urgency. So with that, let me say thank you for participating today, but stay tuned. I'm sure that we will have more discussions on this topic, and I hope that we will continue to be able to do at least some of them in the format that we have returned to today. Thank you very much for all of you for participating.
Thank you. Thank you.